Of God, the most compassionate, the merciful. Hello, I'm Dr. Tahir Ali Zamir, the Assistant Professor of Anatomical Sciences from Hamadan University of Medical Sciences, Iran. In this presentation, I want to speak about the bones of the lower limb. Okay, let's see. The lower limb contains some bones, which we can say the majority of them is categorized in the long bones, and some of them is classified as a short bone. But without considering about the aspects of the morphology of these bones, let's see about the names and the place and situation of each bone in the lower limb. The lower limb from above to the below contains a part which we call it the pelvic girdle. In the pelvic girdle we can see the hip bones or innominate bone. The other name for hip bone is innominate bone. Hip bone or innominate bone in each side, and after that we can see the femur, the most or the longest bone in the body. After that we can see the tibia, and the adjacent bone is fibula. After that we can see the tarsus bones, metatarsus bones, and the phalangeal bones or the phalanx. Let's see. The first bone that I want to speak about it is the innominate bone or the hip bone. The hip bone is classified as a flat bone which has a has a feature like the part for like a plain blade twist, and we can see it has 3 different parts. The hip bone in the superior portion has a part which its name is iliac bone, iliac portion. In the inferior anterior we have another portion of the hip bone which its name is pubic, and the last one in the inferior and posterior portion, it is the ischium. The reason for naming like this, for one bone we have 3 portions with different names, refers to the embryologic stage, which we had 3 center for ossification for the hip bone. So by this fact and on the basis of these 3 center ossification, we have 3 parts and 3 portion for one hip bone, which finally and by maturation they fuse to each other and become one, which that name becomes hip. So in the superior portion we have iliac bone, anterior inferior pubic bone, and posterior inferior ischial part or ischial portion. In each part we have different features. For example, in the iliac portion we have a crest which start from anterior part, continue and goes toward the posterior portion or aspect of the hip bone. At the anterior and posterior tip of this crest we have 2 spines because they are sharp and like a spine, so we call them ascis anterior. It means this abbreviation means anterior superior iliac spine, and pescis or posterior superior iliac spine. Between ascis to pescis we have the crest that its name is iliac crest. Here. Okay, But below the anterior superior iliac crest, we have another spine, which it locates inferiorly, which its name is anterior inferior iliac spine. Of course, in the posterior aspect, we have also another tubercle or spine. Exactly, I say it is the spine, which its name is posterior inferior iliac spine. So we have 4 spines in the portion of the iliac part, which I told you about their names. So we have 2 aspects, the external surface of iliac portion and internal surface. The base for naming internal or external refers to the adjustment or nearity to the content of the pelvic part. So moreover, we goes toward the contents of the pelvic girdle, we moves toward internally, but the opposite of this means that we goes toward the external part of the pelvic. After speaking about the iliac portion, let's see the features of the pubic bones. In the pubis, we have a part which its name is pubic tubercle. The pubic tubercle here is a part which is a station and is a place for attachment of inguinal ligament in the internal part of the inguinal ligament. After the pubic tubercle, we can see the pubic crest, internal part of the pubic tubercle, and also we have 2 ramus. We define 2 ramus for pubic bone. Here, superior and inferior. Moreover, the pubis has a body between the superior and inferior ramus. In the inferior posterior portion, we have the ischial bone. In the ischial bone, I can say that the most important features for the ischial bone is the ischial tuberosity, the place which in sitting down position the weight of the body can transfer and moves to the ground by this place. Okay, between these 3 portions, between the iliac part, pubic part and ischial part, in the external aspect of the hip bone, we have a cavity. We call this cavity, or we name this cavity, the acetabulum. Acetabulum, here, is made from 2 parts. The border of this cavity is articulated, but in the center we can't see any aspect of articulation, and it refers to the function of this part for having a stability for the hip joint, which you can know about them later. Let's see. After the hip bone, we can introduce the femur. The femur is the longest bone in the body. It locates vertically, and it has, like another long bones, 2 ends, the superior ends and inferior ends, and a shaft. In the superior end, we have some features. I want to tell them and explain about them. First, you can see a part like hemisphere, which articulated by a cartilage surface, I mean by the articulation surface, which its name is head, the head of femur, the head of femur. After the head, we can see a part which it is narrower than the head, narrower than the head. I mean the diameter of this part is smaller and is lower than the head. It is neck of head, neck of femur, neck of femur. So it is head, it is neck of femur, which the head and the neck, both of them has a degree, with the shaft. And after the head and the neck, we can see two dominant tuberosity, which their name is greater trochanter and lesser trochanter. Greater and lesser trochanter. Between the greater and lesser trochanter in anterior and posterior aspect, we have two elements. First of all, in the anterior surface or anterior aspect of the femur, we can see a line. The line which connects the greater trochanter to lesser trochanter is intertrochanteric line. But in the posterior aspect, the element which connects two trochanter to each other is intertrochanteric crest, because the thickness of this part is more than a line, so it becomes a crest. Intertrochanteric crest. After speaking about the superior end, let's see about the inferior end. In the inferior end or inferior extremity, we have two parts that we call them condyle. The middle or internal condyle and external condyle. It seems that the internal condyle is bigger than the external or lateral condyle, but both of them has a surface for articulation of the knee joint, as you see. Between the internal and external condyle or lateral and medial condyle, we have the fossa in the posterior aspect, and we have a surface in the anterior aspect. The name of the fossa, which is located in the posterior aspect of the femur, is intercondylar fossa. But this surface name is patellar surface, because this surface is specialized for articulation with the patella here. Above the medial condyle, we can see the medial epicondyle, and above the lateral condyle, we can see a part which its name is lateral epicondyle. The most dominant point in the medial epicondyle becomes adductor tubercle, because it is the place for attachment of adductor magnus muscle. So the name of this point becomes adductor tubercle. But first of all, I must told you about the placement of each bone. I mean, when you have a bone, how can you understand and guess about the placement of the bone? How can you guess where or for which side it is, for left one or for right side. I must tell you that when you see the intertrochanteric line, it means it is the anterior aspect, and where you see the intercondylar fossa, it means that this surface related to the posterior aspect. Of course, the head must located internally. So when you have a bone in your hand and watch it and want to guess which side it refers to, pay attention about the location of the head, because the location of the head is internally, and pay attention about the intercondylar fossa, because it must be in the posterior aspect, and of course pay attention about the intertrochanteric line or crest, because the intertrochanteric line must be in the anterior surface and intertrochanteric crest must be in the posterior aspect. But how about the shaft? The shaft of the femur is when we section from this part and see from above, we can see it likes a triangle, which the base of triangle is anteriorly and two aspects of them located posteriorly. So a posterior border or linea aspera is located in the posterior, and the two others border, one of them becomes medial border and the other becomes lateral border, separate the different surface of the shaft from each other. Okay, in the next presentation I will speak about the tibia and fibula and the remain bones from the foot.